I'm Randy Benally. Just before I begin, I just wanted to start with by saying that I work for the Hispano Chamber here in town, the Albuquerque Hispano Chamber of Commerce, and we contract with BeWellNM to do all their outreach and education. And Dominic here is a coworker of mine, and he was involved in BeWellNM. And do you want to explain the chamber and how the contract?
Of course. So, hello everyone. I'm Dominic Baca. I'm also from the Albuquerque Hispano Chamber of Commerce. I'm a destination sales representative. I work with the Convention and Tourism Department now. Formerly, I was with BeWellNM on Randy's team. And essentially, BeWellNM is contracted the Albuquerque Hispano Chamber of Commerce to be the primary contractor for outreach when it comes to getting the word out about what's available to New Mexicans when it comes to affordable healthcare. Through the New Mexico State-Based Health Insurance Exchange.
Thank you, Dominic. Yep. So I thank you for you guys that are here and those of you guys that are out there in Zoom land. So we're going to cover today important healthcare information for Native Americans. Okay, so today we'll cover, for those of you that are wondering, what is BeWellNM or what is this all about? What's the important healthcare information for Native Americans? So we'll cover the agenda today: mission, the mission of BeWell, who is BeWellNM, what is healthcare insurance, marketplace affordability program, benefits for Native Americans, with to enroll, and Medicaid unwinding. We're also going to cover that, which is currently what's happening, and that's kind of spurred this whole activity today. And so, I'll break two things here. So the mission statement for BeWellNM is to promote efforts to educate and enroll New Mexicans in affordable healthcare coverage that promotes better access to timely, high-quality healthcare. And next, please. And who is BeWellNM? BeWell is the only place where consumers can shop, compare, and enroll in qualified health plan, marketplace, or exchange. The best way to understand that is like if you go to Expedia and you want a cheaper flight to wherever, you can go into the airlines, get your, shop and compare whatever flights you can get. So that would be the marketplace exchange for qualified insurance companies that we sell. Compare plan options side by side applies to like apples to apples, basically. And the only place to qualify for premium subsidies to help reduce the cost of insurance, the insurance healthcare coverage. Find local certified free help to enroll. We do have our own brokers that we work with that are certified through BeWellNM. And also enrollment is definitely made easy. Next slide. And what is health insurance? I know among the Native American community, health insurance is somewhat kind of just out there. Unless you have been employed, you've probably signed on to your employer's health insurance. Or if you've used Indian Health Services, IHS, most of your life, you probably are not too aware of what health insurance is. So in this case, we'll cover that just a little bit briefly. What type of health insurance covers the cost? Basically covers costs of insured individuals' medical and surgical expenses, as well as medication. So in a nutshell, that's basically what healthcare insurance is. What is a qualified health plan? Qualified health plan, basically it's certified by the health insurance market. The marketplace provides essential health benefits, follows established limits in cost sharing like copay, co-insurance deductibles, and out-of-pocket maximum amounts. and meet other requirements under the Affordable Care Act, which of course covers a pre-existing condition. I don't know if you all remember back in the day when they were discussing Affordable Care Act, one of the biggest things was pre-existing conditions. So that it covers that. And then within the qualified health plan, there's 10 essential health benefits. Those 10 health benefits, as you can see, is first, obligatory patient services, emergency services, hospitalization, maternity and newborn care, mental health, substance use disorder services, such as behavioral health treatment, prescription drugs, rehabilitative, services and devices, laboratory services, preventive wellness services, chronic disease management, pediatric services, including oral and vision. Those are the 10 essential health benefits that basically makes a qualified health plan. The participating qualified health plans for this year, if you can see there, starts with M-Better, which is otherwise known as Western Skies, or vice versa. And the next one is Blue Cross Blue Shield. Now, Blue Cross Blue Shield offers health and dental as well. Molina Healthcare, Presbyterian Health Plan, and for dental, there's a standalone Best Life. Those are the carriers that we work with. And next slide, terms to know. Terms to know in healthcare basically is premium. That's what you pay to retain your coverage every month. Basically for those who have been employed and have worked in areas of under a company or employer, that's how much they take out of your check. That's the premium, the monthly premium. The deductible. Deductible is generally the amount you pay every year before insurance coverage starts. Out-of-pocket maximum. The most money you're going to spend on healthcare in a calendar year. Co-insurance, generally the percentage you pay out of your pocket after deductible and before your maximum. Co-pays, a flat dollar amount that you may pay for a particular service. So those are some of the key points in an insurance healthcare coverage. And we'll cover some of that here a little bit. Next slide is when choosing a plan, what to consider. So first off is my primary doctor in the network. Those of you who have primary doctors. And how much is my premium going to be? How do I qualify for financial assistance to reduce my monthly premium and my out-of-pocket costs for care? And next, does it cover my medications? If so, at what cost? And these are the questions that you need to be asking. And lastly is your out-of-pocket maximum. So these are questions that you need to be asking. Again, like I said, we have brokers that we work with that are certified through BeWellNM. And again, and we'll cover that a little later, but if you're interested, we can set you up with that and they will break these down for you. And if you understand and know these points here, the brokers will explain that to you a little better and also help you in trying to see if Crest is better than Western Skies or Blue Cross Blue Shield. Is my doctor in the network, my primary care doctor, those kind of things. So next slide, Marketplace Affordability Program. Marketplace Affordability Program, otherwise known as MAP. Other names that you may hear is going to be BeWellNM State Affordability Program, Healthcare Affordability Fund, Healthcare Marketplace Affordability Program, MAP. The important thing to understand about MAP here is that it has two key programs to reduce monthly premiums. That's what we want to hear, right? Reduce monthly premiums, and which is basically the New Mexico Premium Assistance and Native American Premium Assistance, and that reduces monthly out-of-pocket costs as well through the Turquoise Plan and Max Savings, which we will cover here in just a bit. And how does MAP work? MAP works through the New Mexico Premium Assistance, income levels up to 400% of federal poverty guideline, who qualify for the federal premium tax credit on BeWellNM. The Turquoise Plan provides, that's provided by the state, helps you with that. And we'll take a look here in the next slide in regards to that. I keep mentioning turquoise plan, but it's extra savings. What that means is that you'll be able to save on your monthly premium that you pay, as well as your co-pays, deductibles, all that we've mentioned so far. Now, the Native American Premium Assistance includes, that's included in there is provides no-cost premium options to members as a federally recognized tribe up to 300% of federal poverty guideline who qualify for BeWellNM, and also reduces premiums between 300 and 400 federal poverty level guidelines. Max saving plans, extra saving plans. So those two extra criteria there that you can save money on. And of course, you have to qualify on this based on your annual gross income, as well as your tax, family, household, how you file your tax. That's what they look at. And let's see. So the next slide is going to be the turquoise plan. Premium assistance. Examples of how max saving plans can save you more on your healthcare plan. So I've explained all these things so far. If it doesn't make much sense, it's okay. Because now you can see on here, if you look at the screen, there's 3 different examples it gives you. The first one, we have Becky and Paul, a married couple, Native American. Between the two, they make $69,000. They live in Gallup. You guys know Paul and Becky, they live in Gallup. They have a child, and their monthly premium, if you look at that, I think before I start here, if you look at that, in each 3 categories, there's zeros next to all of those. These are the savings that I had just explained a moment ago. Again, if you don't understand anything that I mentioned, it all equals up to 0 cost and a bunch of savings for you. So let's take Paul and Becky again, 1 child, $69,000 a year, and monthly premium. Without the assistance, it would be $1,012. With the assistance through BeWellNM, it's 0. The out-of-pocket max, $18,200 for the year, 0 through BeWellNM. Annual deductible, $6,900. Again, through BeWellNM, it's 0. And the primary and specialty care, generally $20 to $35 every time you go, 0 through BeWellNM. Urgent care and ER visits, anywhere from $50 to $600, looks like, $0 again. And this, again, is because of the extra cost savings and tax credits that's allowed or affordable to the Native Americans. And Kin, another example here, is 27 and makes 27,000, lives by himself, single, no kids. Again, if you look at that again, without assistance, $227. Through BeWellNM, it's 0. Out of pocket, $9,100, again, 0. And the deductible, $6,800, 0 through BeWellNM. Primary and specialty care, 35 to 40%, 0 through BeWellNM. Urgent care and ER, $35, 0. So the savings is there. Next criteria is Juliet and Frank, a married couple. They have no kids. They live in Ames. And they make between the two $30,000. And again, if you look at the monthly premium, it would be $541. Through BeWellNM, it's 0. And the out-of-pocket savings max is, the out-of-pocket is $18,200, and it's 0. Annual deductible, $6,900, 0 again. And as you can see for yourself, it's all zeros. Zeros because, again, because of the premium assistance. For Native Americans, they get extra. So, that's what I'm trying to explain here, that we've covered so far. So that's what's offered through BeWellNM through Native Americans. And zero cost sharing that I just mentioned. Native Americans with income at or below 300% of federal poverty guideline. Basically, what that means is they may be able to enroll at zero cost sharing plan, no copay, no deductible, no co-insurance, receiving care from Indian healthcare service providers, or receiving essential health benefits through a qualified health provider. So as you saw, it's just explaining again the premium assistance. And in addition to this, there's no need for referral from an Indian health service or tribal health provider when receiving the essential health benefit through a qualified healthcare provider. What that means basically is you can take your insurance card wherever you have it through BeWellNM. You can still go to Indian Health Services. The cool thing about this, which I'm trying to get people to understand, or we at BeWell, is most of our Indian healthcare services have to budget money every year. And every year it gets cut, right? So when a native goes there, they don't want to get health insurance, or they don't have health insurance. IHS digs in that budget, their pocket, and they pay for that care. So if you had coverage through BeWellNM, you could actually help IHS, your local clinic, supplement some of that money. They would third-party bill the carriers that I just mentioned. And your local clinic or your IHS could have some money come back into their budget and have services paid for that way. In the long run, basically what this means is your IHS or your 638 clinics, community clinics, could have extra money to pay for administrative, to pay for maybe even another provider. A quick story. I was at an event and I was explaining this to an IHS worker. There was two ladies there. And as I'm explaining to them and trying to tell them, how BeWellNM could help IHS supplement in the manner that I just explained, her partner, her coworker, looks at me and she says, I don't know if she was listening. I take it she wasn't. She looks at me and she says, can I take some pins? I said, yeah, take as many as you want. She says, yeah, the ladies at work told me I should get a lot of pins because we're always running out of pins. That's the example I'm talking about. IHS is always lacking funds. And if they had BeWell, if the individuals were covered and they qualified, and you saw all those zeros, right? See the zeros here. They could help their clinic or their IHS supplement some of that money that gets cut every year. So that's, in short, basically, it's a very good program. It's a win-win. Yes, sir.
How does that connect into reliance on contract health?
Well, contract health, basically, as I mentioned, you don't need, because if you have a PCP already with Press or Blue Cross Blue Shield, you just go to your PCP and you get your referral that way. Whereas through IHS, and I don't mean to say anything bad about IHS, but they have to wait and see who can they contract out with, which of course, so, and then see where you need to go for it. For people who live close to Albuquerque, they don't have very far to travel. But if you have people that live out further in the outskirts, then you have to wait to see if there's an opening in Gallup, Durango, Albuquerque, Flagstaff, wherever they contract with. Then you have to travel there. So just an example. That answer your question?
Yeah, I'm just brought that up because it's very pertinent sometimes because of the because we have to jump through some hoops regarding contract health. You can't always access the health care that you need, and sometimes certainly not very quickly.
Right.
That's the system set up or has been.
Yes. So it's, again, it all goes back to education. It goes back to just understanding how the whole thing works. So next slide. So this next slide is going to talk about zero cost sharing. That's basically what we've just been discussing. So, and that's why you see all the zeros in the turquoise plan. Okay, next slide. Limited cost sharing. Again, another explanation of the zeros in the turquoise plan. Extra savings. What does this mean? It just means extra savings for Native Americans, to where you can see those zeros if you fall into that 300% federal poverty guideline. And next slide. Benefits for Native Americans. So Native Americans, this is the cool thing. This is the beauty of it. You can enroll anytime. Enroll anytime. Traditionally, right out there, when you are signing on with a health insurance, you have to wait till open enrollment. I'm sure you guys have probably heard that. But we can't sign you up now because you have to wait till open enrollment, unless a life-changing event occurs, such as you lose your job or changing jobs, or if you get married, life-changing events. Then you can switch carriers. Otherwise, you have to wait till open enrollment, which is generally between November, 1st November through January 15th every year, which is the same, even for employers. It's the same. So you can enroll anytime, not limited to open enrollment or special enrollment period. You can access care to IHS or Tribal Health, as we mentioned. You can take your insurance card and take it to IHS if you still wish or prefer to go there. Sometimes it's a lot easier because it's close by. You can access care at a contracted provider or facility through the insurance company. Useful if you live far away, just as we explained here. And Mr. Kafoya's question here a moment ago, that you don't have to travel far away. And if you're traveling out of state or on vacation and need insurance, attention for your qualified health care, BeWell can cover that also. So remember, these are qualified healthcare plans. And next slide. When can I enroll? Again, as I mentioned, it's year-round. The other thing about this, which I failed to mention, or it's not in the slide, is you can also change plans. Because when you sign up for a plan through your employer, generally you can't change your plan. You're stuck until open enrollment, till November or January. Then you can change your plan. A lot of times we sign up for a plan and we say, oh man, I wish I would have got the better one or maybe the cheaper one, whichever one. But anyway, in this case with BeWellNM, you can change your plans. You can change your plan once a month. So, which means within these plans, which I'm not going to go into very deeply, but there's 3 coverages under each of the carriers. There's a gold, silver, and a bronze plan. And each of those plans carry different costs, different coverages. And so you can change from gold, silver to bronze, depending on how much you want to pay, how much coverage you want to get. So that's the cool thing. Health insurance is more affordable than ever. What do you guys think? Is that what it sounds like? We're Native Americans. So for the general population, there's still cost savings as well. They also have the turquoise plan, but for Native Americans, you get more savings. Max savings is what they called it, that we covered here just a moment ago. Now about enrollment. Next slide. Where do I enroll? Well, currently right now, BeWellNM has established sites where you can go to get more information on this and enroll. First one is certified assisters over at Santo Domingo Healthcare, the Pueblo Laguna Benefit Services and Laguna Health Community Center, as well as the Taos and Piccaries Healthcare Centers. They have certified assisters that can help you go through that, and they go through the premium, the copay, co-insurance, all that information, coverages that you needed, as well as maybe even if you're on medication, the pharmacy, what medications are covered. They can go through that with you. And then the second one there is the Elite Native American Brokerage Partnership. BeWellNM has made a partnership with Lorraine Y. Chavez Insurance Agency, and their people go out to these locations. So if you go to those locations and you ask to make an appointment with BeWellNM, they'll set you up with one of the brokers through Elaine Y. Chavez Insurance Agency. They collaborate with the IHS 638 coordinators and the insurance specialists, provide education, enrollment support to Native communities, and where they don't have any certified assisters. So, yes.
We have a question in the chat. Does BeWellNM cover naturopathic treatments or acupuncture?
They probably do. That would be a question for one of the brokers. They pull up the summary of coverages, because all of that is in there. And when you do go, ask for a printout, because they can give you a printout. This is the thing that you usually get in the mail that tells you what's all covered in your services. So I know New Mexico had broken up chiropractic and other specialties. So I would assume that naturopathic would be under other specialties. So, because the reason why I know is because I used to partake of naturopathic. And at that point, chiropractic and naturopathic were together, but now they split it. So the visits have been split.
And so when you enroll with BeWellNM, do you choose like the Cross Blue Shield, so you choose which one you
Yeah.
want through BeWellNM.
Right.
And so I assume it kind of depends on the coverages of each of those ones.
Right. Their benefits, yeah, your benefits schedule guideline.
So maybe one of them would cover it and maybe
I believe they cover it. I remember when they made that change, I was with Presbyterian. So I believe they still cover that. But that would be something to look into when you do your benefits, you're with broker or certified sister.
If I could just make 2 points as well, there is a diaspora, so there's about 35 to 46 different plans, ranging from about 5 to 7 of each plans of those carriers. So there is a diaspora, and then each one is outlined differently. So that's why it's super important that you talk to a broker. And again, all of the broker meetings that you may want to meet with a broker, that's free. All of those services are free. So if you just have a question and you want to reach out to one of those brokers or certified assisters, no one should be charging for those services.
Yeah, thank you, Dominic. Just for those of you that are just coming on board with us or missed Dominic's introduction, Dominic is my coworker. He was actually working with me on the BeWellNM project, so he's well versed in BeWellNM as well. So basically, just to sum up what he's saying, the brokers that we have available, it's all covered through BeWellNM, so you don't have to pay anything or nothing. Basically, you're not even obligated to sign on with them when you meet with them. So that what they'll do is I'll just walk you through really quickly. What they'll do is they'll enter you into the BeWell system. You'll get your information will be entered, your income will be entered, and then you'll get to see what kind of healthcare plan that you can is available to you. And at that point, you're not obligated. You can take it home and with your login and password, you just log back in conveniently, look it over again, And then when you're ready to make a move, just call them back and say, this is the one I want to go with. Or maybe consult with them again and say, hey, him or her, I'm sorry, there's male and female brokers. Consult with them again and say, what do you think about this? Or compare, or even compare plans. Like you were saying, you know, what's the difference between choosing Blue Cross Blue Shield, Press, and Western Skies from Molina? So you can compare and see what's all covered in that.
Are most other brokers educated well enough about BeWell and this whole area?
Yeah, they're the brokers that we use, that we have,
Not just yours,
are all, well, the ones we use are all certified through
Right.
BeWellNM. But there's probably others outside that probably know about BeWell. BeWell has been around since 2013, right? 2013. So they probably have worked with BeWell at a time or two. But the ones we work with, the ones that we refer you to, are the ones that are certified through BeWellNM. So, yeah. Next slide. Okay, here I want to cover a little bit about Medicaid. The state right now is going through what's called the Medicaid unwinding. And I think it's been in the news, you probably heard about it in the commercials and radio and everywhere. But just to explain to you what Medicaid unwinding is, what that means is it's that the state of New Mexico will again require individuals to renew their Medicaid coverage. Individuals with incomes above Medicaid eligibility thresholds will likely lose their Medicaid coverage. And what this means is for people who were, I guess to break it down really quickly, people who were on Medicaid prior to COVID, they'll most likely stay on Medicaid. People who got on Medicaid during COVID because they lost their job or their hours were reduced, now they're back at work, they're still on Medicaid, those are the ones that are going to lose coverage because they're probably over that Medicaid threshold. Medicaid threshold is 133% of federal poverty guideline, which is a far cry from 300 that we were just talking about. So those people are going to fall off. It's and most likely those people, when they do renew, it'll be their first time renewing. So if you are on Medicaid, got on Medicaid during COVID, you're on Medicaid, you haven't had to renew anything. State has actually been renewing for you according to the federal policy and laws. Well, that basically ended the public health emergency. It ended, and so that's why there's an unwinding now. So it just isn't the state of New Mexico, it's the whole country. The whole country is going through this. And so basically in New Mexico, approximately 110,000 people are no longer going to be financially eligible for Medicaid because now they make over Medicaid threshold, 133%. That requires for you to be eligible for Medicaid because they've come back to work. The second point, HST began a process of notifying people who need to renew their Medicaid coverage beginning March 15th. And at that point, they sent out turquoise envelopes, and if you haven't received your turquoise envelope, it's probably coming because they broke it up into 3 months, 90 days. So the first batch, of course, has gone out on the 15th for all those in April, and then for May, and then for June. So which all equals roughly around 110,000 Mexicans. So the turquoise letter, it's going to tell them to renew their eligibility for Medicaid coverage. Now, if you're familiar with the 133% of federal poverty guideline, and you're making a lot more than that, then chances are you're not going to qualify again for Medicaid. So, but if you're around that area, you're close to that, I encourage you to just go ahead and renew. So when that happens, then you'll either get a denial or approval, Or if you chose, because you believe that you're over it, you're not gonna do anything, then you'll get a closure letter. So either way, you'll get a denial or a closure. Or you'll still be on Medicaid if you still qualify for it and make around under 133% of federal poverty guideline. So these letters have been sent out. If not, they're still coming, which we'll get into in a little bit here. Those who opted out those who opted for electronic communication, they're going to be receiving their notices or notifications through email. So the best thing I can tell you at this point regarding those letters is update your information, update your email, update your address. You requested a letter be sent to you, because that way you'll get it. You can update it through your Yes New Mexico portal. So update your information. And next point, people who lose their Medicaid coverage will still be eligible for other forms of health coverage, such as their employer-sponsored coverage or affordable health plans through BeWellNM. So for BeWellNM, basically, if one of these people in this group, what BeWellNM is going to require of you is, if you do work, you've gone back to work, to go to your employer and check with their health sponsor through your employer. And now the thing here with that is, if your health insurance is going to cost you more than 9.1%, then you can actually opt out. You can come to BeWell. So 9.1% of your income. That's just simple math. You can opt out of that. You can come to BeWell and get on the turquoise. So, and if you have any questions on that, you can send me an email or contact us. 133%, which is pretty much general. I keep throwing that out there. Sorry, I didn't put a guideline there for you, but if you just Google 133% of federal poverty guideline, it'll tell you what it is, because that's set by the feds. It doesn't change from state to state. It's the same. So next point, consumers who lose their Medicaid coverage have 60 days from the date they apply for new coverage or is eligible for coverage through BeWellNM. So not 60 days from when you lose your Medicaid. It's 60 days from when you start applying. So give you an example. Let's say Dominic, he got a closure letter. So his 60 days doesn't start there. Doesn't start until he waits. Let's say he doesn't get his letter. He just throws it to the side along with all the other letters, like we all do, right? Because you get a bunch of junk mail. And then 3 weeks later, he looks through his mail. He says, "Hey, here's my turquoise letter." And so he then finally starts to initiate contact and communicates with BeWellNM. At that point, his 60 days starts. Once he gets into the system of BeWellNM and starts making that. So that's 60 days. 60 days is a fairly good time length to get enrolled into a program. So next slide, HSD updates. So when you're talking about changes and then talking about government and a huge group of people, you're always going to run into some problems. Well, latest HSD update is there is a backlog of those letters, those turquoise letters. So if you're wondering where my turquoise letter is and your information is correct as far as your mailing, your email, and you haven't gotten anything, you're probably one of these individuals that has a backlog. If not, you're probably down the road, maybe later this month or in, later this month. So there is a backlog. So what that means Delays don't impact coverage and consumers can continue to access care while their redetermination is being processed. So you're still covered. So again, like I said, your coverage doesn't stop until you either receive a cancellation letter or a termination letter. Okay. And next point, HSD has developed a video to help customers identify their redetermination date. And you can do this through Renew New Mexico. Renew New Mexico is an actual website. And if you just Google Renew New Mexico, the website will pop up. And in there, it's go to the subsection of how to renew online video. It'll show you how to do it step by step. And consumers also need to wait for their turquoise letter. So what that means is if you haven't gotten your letter, your information is correct, your email, your mailing address, and you're just like, I gotta know. Don't re-register, please. All you'll do is this, you'll create a duplicate of yourself through the system, which is gonna cause a lot more headaches. So just wait to get your letter. And if you wanna check, make sure your information is correct, you can do that. Go into the Yes portal and look at your email and your mailing address. And if you need to, you can go to the office. I don't encourage you to go to the office, but if you need to, go to the office and check. I think most of the HSD offices are open again, and I think they're taking people now. It's not where you have to make an appointment anymore. So, but you can do everything online. I think they're trying to make everything to where it's all online. But if you need to go to the office, you're welcome to go to the office. But you can go to your Renew. And the other thing is use your Yes New Mexico portal. And you can actually identify your redetermination date through that. Again, if you are not familiar with how to use that or how to get onto Yes portal, this renewal video will actually show you how to do that. It's very informative. The next is learn how you can support consumers through Medicaid unwinding. Again, just visiting that website. It's a very good website, very informative. Human Services did a pretty good job in putting that together. It's for this whole purpose. So, and next slide, resources, website. If you want to go to BeWellNM, get help replacing Medicaid. You can click that also, and it'll give you a bunch of other resources, information, and videos as well. And you can even call our Customer Engagement Center at 1-833-862-3935. You can also do an online chat service through BeWellNM.com or learn more through the knowledge base articles. And of course, they would want you to like us and share us with social media as well for more updates. Another thing that I wanted to throw in here also is at the moment also we are doing enrollment events. So if you go to the BeWellNM website and you go to the calendar of enrollment, it'll tell you where the enrollment events are taking place. It's statewide. So right now my other coworkers are in Las Cruces doing an event. And our next event that's coming up in this area is going to be on the 24th of June over at the BeWellNM office location off of Jefferson. So if you go to that calendar, it'll tell you, it'll give you the address, give you the time, and I think they're planning on a big old get together. They have a lot of stuff planned there to try to keep the kids busy. I think they have activities for them. And so forth. So they'll have it there in their parking lot. And lastly, if you need more information, or if I went too fast, or you had a question, or maybe you'll get a question later, you can reach me. Randy Benally, Native American Community Outreach Manager, through the Albuquerque Hispano Chamber. The best way to reach me is through email. because I'm always in and out. And then Miranda So, she is the American Liaison Manager for BeWellNM. She's located at the Jefferson location. So, any questions? Any questions from the group? We're out there.
Nothing in the chat right now, but I have a question. So what would you say the best demographic to reach out to BeWellNM? Because like, for example, myself, I get health insurance through my employer, but maybe qualify for more savings if I went to BeWellNM. Could I try to do that, or is it for people who are self-employed, or like, who should I reach out to? Everyone, or are there like particular people?
Right. So BeWellNM, you know, I guess that's to answer that question. I mean, with Dominic and I, when we went to different events, every time we would say BeWellNM, state-based health insurance, Mexico Health Insurance Exchange, or mention Medicaid and the unwinding, everybody would always think that it's low income. We're not low income. The best thing to associate BeWellNM with is affordable healthcare. Affordable healthcare for individuals who are working, employed, self-employed, own businesses, like some of you out there. It's affordable healthcare. It's affordable healthcare for the state of New Mexico. So if you are employed and you're questioning, well, you know, this sounds great, or know somebody that's employed, again, just a simple math. If health insurance is costing you more than 9.1%, you can opt out. And you can actually explore BeWellNM and see what kind of savings you can have. So it's affordable health care for everyone.
I have another question. So my fiance is here. He is self-employed. We're not married yet, but when we get married, he's a Native American. I'm not. Would he only qualify for those special circumstances for Native Americans, or if we're married, both qualify? I'm just curious on that too.
Yeah, unfortunately, he would be the only one that would qualify, because it's based for Native Americans.
But our children.
Children would qualify also.
Would non-natives qualify for other programs in
Yeah.
the US?
Yes, non-natives qualify for cost savings as well,
Yeah.
but not as the max savings as Native Americans would. But yeah, so non-natives will still qualify for cost savings.
You may not see those zeros in that example that Randy showed, but it will be very well reduced. I mean, from $300 to $20. And so for the general population, there is very high cost savings as well, just not at the maximal benefit that is allotted to Native Americans.
I guess a good example of that would be like, let's say, for most of you who had employment and had employer health insurance, they take out roughly about 120, 130 every pay period, roughly. So with non-native cost savings, it's going to be less than that. So if you take what 120, 130 every 2 weeks in a month, that's $250 a month that you're paying for in employer healthcare. For non-native, you'll probably be paying half, if not a fourth of that, or even less than that. I mean, hey, come on, that's crazy. But that's basically how BeWellNM works with the cost savings, particularly for the turquoise plan.
When you once you hit 65, you can't qualify for BeWellNM.
Right. This is for individuals. This is for individuals between the ages of 19 through 64. The reason why we say 19 is because prior to 19, most individuals usually qualify for state Medicaid, whether it's full covered children's Medicaid or the S-chip Medicaid, which a lot of the New Mexican kids are on right now. For those 65 and older, they should be on Medicare. Unless they're not on Medicare, then we can actually help them get coverage. So, but they should be on Medicare, so they have coverage already.
We're always wondering what's the cheapest option. We're sort of at that point. My wife is about to sign up for Medicare. Simply because we think that's the cheapest option for her.
So you have to have Medicare when you turn 65.
Right.
It's the law, or else you'll get penalized quarterly. And so unless you have a qualified health plan, say you're working
Right.
and you are employed and you have employer coverage and you're 67, so long as you're working and you have that qualified health plan, you won't get penalized. But once you retire, you will have to go to Medicare. And at that point, there's various plans as well. And so you have Humana, you have Molina.
You don't really have a choice after you get to 65.
You don't have a choice to get Medicare or not, but you do have a choice in what Medicare coverage you seek
Right,
out.
but it has to be through Medicare.
Unless you continue to your employment with Walmart as a greeter and get on their health plan system, then you don't have to opt into, or excuse me, you're not required to get on Medicare. It is a requirement. So yeah, that's why we cover those age groups. Now, another thing that I wanted to mention also is we cover people who are in between jobs, who don't quite qualify for Medicaid. And we cover people who are maybe close to retirement, who are not quite on 65 or on Medicare yet. There's a lot of people who do take 2 or 3 years off. And we cover those individuals as well, based on their current income that they have. Another example also is in some of the events that we've been at. Most people have employment through schools, state, local government, and their years of service of 25, 27 years. They retire, and all of a sudden they're looking at, well, how am I going to pay for healthcare? They make too much for Medicaid, and the only thing they're being offered is maybe their retirement board health plan. But because they're not of retirement age, they have to pay the full amount, which is usually over $1,000. We can cover those individuals as well. So, and most people who do retire like that, they want to take a year or maybe a few months off before they go to their next job. So we can cover those individuals and they can have coverage through BeWellNM. So, any questions? Yes, sir. Oh, I'm sorry.
For the plans in the BeWellNM, is that the individual plan or do you have a family plans?
There's individual plans, and then there's family plans also. So it's kind of an interesting topic because, as I mentioned, in New Mexico, there are a lot of kids who are on the S-chip program, and generally those kids are usually on the S-chip program, and rather than the full covered because their single parents, make more than the full covered Medicaid for children, so they're on the S-chip, and sometimes those parents, maybe their insurance is costing them a lot more. They can actually be on BeWell, and their kids can be on Medicaid still. The S-chip.
So it is based off of tax household. So whoever you do your taxes with, if it's yourself or myself, if I have a spouse, I do my taxes with my spouse, then we would be included together.
Yeah, so thank you, Dominic, that's true. So when you do your income, and you provide your income, they are gonna need verification. So if you're self-employed, your best verification is probably gonna be your Schedule C. So what they're gonna do is they're gonna plug in that number, and they're gonna compare it to your last year's filing. And or if you've changed jobs, like more or less, you'll have to bring in your check stub also to verify that, because it'll pull up your last year's income and say that you need to verify your income.
So for the current, you started insurance in September. They would base those premiums and costs on last year's Schedule C.
The income that you report is gonna be compared to last year's Schedule C. So let's say you made more last year, but this year, maybe it's a little less or it's a little slower. And you can actually provide the verification and say, you know, this is my real income now. And that's the verification.
And it may increase your premium assistance as well. Say last year, I'm a self-employed person, I make 70,000 last year, and this year I'm only projected to make 55,000. My premium assistance will probably go up so long as I'm reporting that to them. Yes, my premium assistance, so the assistant, so the premium would go down, the assistance would go
Yeah.
up, sorry.
Your premiums will go down, but your assistance will go up. You'll get more help. The other thing to this with BeWell is if you are self-employed, and I know with self-employment, income goes up and down. But if you're on top of your income, it's important, and even those that aren't are employed as well. If you change jobs or your income changes, you need to report your income. You can go into the BeWellNM portal and log in, report your new income. Because if you don't report it and you just think, oh, well, you know, just worry about it next year, or maybe they won't catch it, they will. So next year, they're gonna compare that. And if you made more for the rest of the year and you were continuing to go off of the previous few months or when you signed on income, all of that will be resolved at the end, and then you'll end up paying back the premiums, because these are cost savings.
That was one of our negative experiences earlier on. We tried to go on and use the government healthcare services. We gave them an estimate, which I guess was too low. So in essence, our deduction, tax premium deduction, changed. So we ended up owing the government something like $8,000 for that year.
Yeah. So these are cost savings and from that's afforded through the government plan. So you have to report your income if it changes. And even if your income drops, report it. It'll definitely put you in that zero premium category.
And the broker will talk to you about it as well once you sit down with them. But usually they try to encourage to guesstimate on the high end so that nothing like that happens.
Any questions?
We do have another group meeting at one, so.
So if you have any questions, and you got my information, or you can reach Cecilia. She can give you my information. Just feel free to email me and try to answer those questions for you.
Well, thank you so much.
Thank you.
And Dominic.